Hi, I'm Dr. Heinrich from Hilton Vet Hospital. Cruciate ligament injuries are the most common injuries in the back leg of dogs. It's usually the cranial cruciate ligament, or ACL as it's referred to in humans, that ruptures, and when that happens, all stability in the knee joint is lost. This can happen as an acute sudden tear or a slow degeneration of the cruciate ligament. With an acute sudden tear, it usually happens when there's an inward rotation of the knee joint causing tension of the cranial cruciate ligament. Now this can happen when your dog jumps up to catch a ball or a frisbee, and as it lands, twists the knee inwards, putting tension on that cruciate ligament, and as the weight of the dog comes down on it, it overloads the cruciate ligament, causing it to rupture. With a slow degeneration injury, that is usually associated with a series of smaller injuries to the cruciate ligament, allowing it to weaken over time and also cause a partial tear. The stability is still intact, but the knee is quite sore. To diagnose a tear of the cranial cruciate ligament, we need to elicit a drawer sign, a cranial drawer sign. Now this is done by holding onto the femur and the tibia and trying to move it to and fro. With an intact cruciate ligament, you shouldn't be able to get any movement. It should be solid. With a ruptured cruciate ligament, you'll actually be able to move the femur and the tibia in relation to each other. That is called a cranial drawer sign and is a positive diagnosis for a ruptured cruciate ligament. Now, unlike humans, dogs need surgery to restore the stability of the knee joint. At Hilton Vet Hospital, we recommend two different types of surgery. The first one is called the LFS, or lateral fibula suture technique, and we do that in small to medium-sized dogs and cats. In larger dogs, we recommend a procedure called the TTA, or tibial tuberosity advancement technique. This is done by cutting into the tibia and moving the tibial tuberosity, which is the front part of the tibia, forward, putting a wedge or spacer in between the two bone portions. That allows it to stay in that position and allows the knee to then function without a cranial cruciate ligament. The procedure I would like to focus on in this video is the LFS, or lateral fibula suture technique. Now, the approach to the knee is from the outside. We open up the knee joint from the outside, then enter the knee joint through the joint capsule and examine the inside of the knee, looking for any damaged tissue. We then remove any damaged tissue if needs be. Then we drill 2 holes through the tibial crest, and we put a strong nylon suture through it and anchor that nylon suture over the fibula, which is this little bone here at the back of the femur. The 2 loose ends of the nylon suture is then tied together with a crimp made from stainless steel or titanium. Once that is in place, the stability is restored, and then it's time for the aftercare. The aftercare is very important and requires about 2 months of restricted activity. The first 2 weeks after the surgery, your pet will have to wear an Elizabethan collar to stop it from licking its wounds. For the first 6 weeks, we don't want any walking except for just in and around the house, going outside to the toilet and so forth. After 6 weeks, you can then start with slow 10-minute walks and then increase it every week with another 10 minutes. Possible complications that can occur with this technique, although it's rare, it can happen. Infection can happen, so we always give a course of antibiotics afterwards. Arthritis in the knee is another complication. To prevent that, we use a course of pentosan injections. Another problem that can happen is a tear of the menisci. The medial menisci especially, this is the menisci over here, the cartilage that provides the cushioning between the femur and the tibia. Then loss of stability of the knee joint can be a complication if the tension in this nylon suture is lost or reduced for some reason. All in all, this is a very successful technique, and we can expect your pet's knee to be back to full function within about 2 to 6 months, depending on the severity of the initial injury. See you later.